Hey everyone, and welcome to The Explainer. We're going to dive right in today because we've got some incredibly fascinating material to cover. We're cutting straight through the dense medical jargon to look at how 3 highly targeted therapies are essentially rewriting the future of rare liver care. We're going to examine clinical data from Mirum Pharmaceuticals and summarize the primary clinical trial outcomes for their 3 major therapies. So expect hard data, key statistical results, and most importantly, an honest look at how those metrics translate into actual real-world patient improvement. It's going to be a good one.
Here is our quick roadmap for today. First, we'll cover the liver disease challenge. Then we look at volixibat for calming itch, brelovitug for halting hepatitis D, LIVMARLI's proven pediatric outcomes, and finally, we'll wrap up with Beyond the Numbers. All right, Section 1, the liver disease challenge, targeting the source. So we are evaluating what we'll call Mirum's Big 3 pipeline. These were developed to tackle some truly devastating conditions, specifically primary sclerosing cholangitis, hepatitis D virus, and progressive familial intrahepatic cholestasis. These are rare liver conditions, but they lead to excruciating, relentless itching, cirrhosis, and potentially even total liver failure. We're going to move chronologically through their development stages. So we'll start with the mid-stage trials of volixibat for PSC, move to the late-stage phase 2b data of brelovitug for HDV, and finally look at LIVMARLI, which is an approved treatment already demonstrating amazing real-world results in pediatric patients. Moving right along to Section 2, volixibat, calming the itch. To really grasp the data from the phase 2b VISTA study on volixibat, we first need to get familiar with the itch-RO scale. That stands for the itch-reported outcome. Now, for PSC patients, severe itching is not just a minor annoyance. It's not like a mosquito bite. It is a debilitating, deep tissue itch caused by bile acid buildup, and it is a massive driver of poor quality of life. So measuring it accurately is absolutely vital for these trials. And check out this standout data point. It's honestly staggering. 56%. 56% of patients treated with volixibat achieved a 2-point or greater reduction in their itch-RO score. Compare that to just 26% of patients on the placebo. That is a statistically significant and frankly a clinically meaningful drop in severe itching.
So why is this happening, right? Well, volixibat works by selectively inhibiting the ileal bile acid transporter, or IBAT. Basically, it actively blocks bile acid from recycling, and the blood work proves it. The volixibat arm saw a massive, statistically significant reduction in serum bile acids, dropping by 33.7 micromoles per liter, while the placebo group actually got worse, increasing by 2.1. That is a huge placebo-adjusted difference when it comes to tackling the literal root cause of the pruritus.
But let's build this so what bridge here. What do those p-values actually mean for a real person? Well, they translate into a totally changed destiny. Using the PROMIS scoring system, the data showed significant trends toward better sleep and reduced fatigue for patients on volixibat. Think about it. Because the relentless itching has finally subsided, these patients can actually sleep through the night, which directly reduces their daytime fatigue. It's a real game changer.
Okay, Section 3, brelovitug, halting hepatitis D.
To truly appreciate this next set of data, we have to look at the baseline for the patients in the phase 2b Azure 1 study. These patients are battling hepatitis D, which is the most severe form of viral hepatitis. Brelovitug is a fully human monoclonal antibody targeting this exact virus. And we're talking about an advanced disease population here. Over half of them, 53%, already had cirrhosis. 21% had highly elevated liver enzymes, specifically ALT, at 5 times the upper limit of normal. And 15% had severe liver stiffness. To put that into perspective, left untreated, nearly half of HDV patients progress to liver-related death within 10 years. It's a very serious baseline. But look at this. At week 24 of the trial, an unbelievable 100% of patients in the 300 milligram once-weekly arm achieved a virologic response. Let that sink in. 100%. That means their viral load dropped by at least 2 logs or became completely undetectable. The delayed treatment control arm, 0%.
And the impact goes way beyond just the viral load. Brelovitug is actively cooling off the liver. By week 24, 45% of patients in the weekly dose arm and 40% in the monthly dose arm saw their ALT levels completely normalize. And again, 0% of the delayed treatment group achieved this. This proves we're seeing a direct reduction in active liver inflammation. Which brings us to a massive turning point for these patients. Liver stiffness, which is measured by transient elastography,
actually dropped by 3.6 kilopascals in the weekly treatment arm. Dropping liver stiffness by that much means we are potentially halting or maybe even reversing the rapid progression toward fibrosis and cirrhosis that so often proves fatal for HTV patients. Next up, Section 4, LIVMARLI, Proven Pediatric Outcomes. Now, unlike the previous two investigational drugs we just talked about, LIVMARLI, also known as volixibat, is an FDA-approved IBAT inhibitor for pediatric cholestatic diseases, so we are shifting from clinical trial theory into longitudinal proof here. If you look at the Phase 2 PFIC trial data, you can see that the solid black line representing LIVMARLI shows a sharp, sustained deviation from the placebo. It drops the severity of morning itch scores sharply in the first few weeks, and importantly, it stays down. It provides consistent, lasting relief for these kids. To understand the absolute ultimate metric of a liver drug success, we need to talk about EFS, or event-free survival. In the hepatology world, an event is something you desperately want to avoid. Specifically, we're talking about requiring a surgical biliary diversion, being put on a liver transplant list, or death. So EFS measures exactly how long a patient lives free from those outcomes. Now, clinical trial data is fantastic, right? But you might be wondering, what happens outside that tightly controlled environment? To find out, we have to look to the messy, real-world data utilizing the NAPF database, which is a massive natural history registry for PFIC patients. The real-world numbers here are honestly mind-blowing. When compared against an untreated cohort over nearly 5 years, the overall event-free survival hazard ratio was 0.29. More specifically, the hazard ratio for liver transplant or death was 0.44. Simply put, this means that children treated with LIVMARLI had their risk of needing a transplant or dying cut by more than half compared to the natural course of the disease. That is incredible. Finally, Section 5, Beyond the Numbers. All this clinical data, it is rapidly moving toward commercial reality. Mirum has an FDA pre-NDA meeting scheduled for volixibat this summer, with a formal submission plan for the second half of 2026. Right around that same time, we're expecting the Phase 3 AZURE data for brelovitug to read out, setting the stage for potential 2027 launch. The science is translating into market expansion at just an incredible pace. So as targeted therapies like IBAT inhibitors and advanced monoclonal antibodies successfully rewrite the clinical trajectory of severe liver disease, keeping patients off the transplant list and drastically reducing symptoms, how will our healthcare systems adapt to managing these entirely new lifetimes of event-free survival? It's a pretty profound shift, turning complex clinical data into real human destiny. Thanks so much for joining me for this explainer, and keep questioning the data.